Now, please welcome Dr. Sean Hashmi to the stage with Dr. Shirley Suda from Woodland Hills. Dr. Hashmi became a partner in the medical group in 2012. He is innovative in fitness and health, participating in leading Walk with Your Doc and Workout with Your Doc. In fact, he's going to lead you all through calisthenics in a few minutes. That's a joke. He's the Healthy Workforce champion, obesity lead, and bariatric medicine champion. You've seen him walking alongside our floats in 2012 and 14 in the Rose Parade. He's a media expert on Kaiser Permanente's behalf and volunteers for the National Kidney Foundation Educational Series. Please welcome Dr. Hashmi and Dr. Suda to the stage.
It is my pleasure, excuse me, my voice is just trying to hang in there. It is my pleasure to introduce to you tonight the Woodland Hills Physicians Exceptional Contribution Awardee, Dr. Sean Hashmi. So you heard a little bit about from Ed about our Walk with Your Doc program. The best way for me to describe Sean to you is that he is an innovative motivator. And that's exactly what he did with our Walk with Your Doc program. About 3 days after joining us in 2009, he came to my office and said, I have a proposal for you, and I need your support. Well, you know how the MAPS goes. Well, but what it turned out is that he needed 25 elastic bands, resistant bands, and 25 pedometers. And with that, the Walk with Your Doc program was born. So what that is every Tuesday at 7:30 in the morning, he gets his patients out there and he leads them in exercise. And I thought, well, how long can this last? You know, it's 7:30 in the morning. Well, this innovator, motivational, he puts in his office the Hashmi Wall of Fame. So his patients get on his Wall of Fame if they come to his class and lose weight. So what patient would not want to be on the Hashmi Wall of Fame? And so that program has gone on for almost 5 years now and has been expanded to our staff through a Walk with Your Doc Friend program. So he did that as a nephrologist. So I really got smart and I put him in the metabolic obesity program. And there he did even better things. So he had noticed how the Woodland Hills referrals to the metabolic obesity program was only about 2 to 3 a week. So he, again, came to me and said, I need your support. I need only 5 minutes at our next physician offsite. So I said, sure, gave him the 5 minutes. And in that 5 minutes, he must have said the phone number for his program at least 50 times. 2344, 2344, just call 2344 and we'll do the rest. 2344, 2344, 2344. And it went on and on. Well, who could not get that out of their head? So the next morning, instead of having 2 or 3 that week, he got 65 phone calls the next day. So now I'm really smart and I make him the physician champion for the healthy workforce. So we were lagging a little bit in the total health appraisals last year. And so he wanted to get the physicians and staff involved into doing the total health appraisals. So he challenged them all that he would do a push-up for every total health appraisal that was done online. And on Halloween Day, he had to come to the auditorium where he did 725 push-ups. And not only that, he recruited his friends and colleagues, and together they did 2,600 push-ups that afternoon. Exactly. So now, I mean, in his spare time, he does other things, and he is also a very dedicated family man. So he takes care of his elderly patients, and along with his beautiful wife, who is here tonight, he now motivates his best innovation, and that is his 15-month-old beautiful daughter, Faith. I present to you the Woodland Hills Physicians Exceptional Contribution Awardee, Dr. Sean Hashmi.
Wow, there's really a lot of you guys out there, and I can't see anybody, so this is perfect. I just wanted to say, really, everybody who's gone up here, you guys, every single one who's gone before me and coming up, you're my role models. You truly are. You know, you always have to stand on the shoulders of giants, and I'm in a room surrounded by giants. Every one of you is absolutely incredible. The only thing I just want to say is in terms of my vision is, I don't really think I work for Kaiser Permanente. I really don't. I live at Kaiser Permanente. My philosophy has always been very simple, is you get this very brief window into a patient's life when they first come into that office with you, and you have to be everything to them. You have to be their friend, their mother, their father, their counselor. Whoever you need to be, you have to adopt and adapt to that role at that moment. Because if you can do that, you can get them to lose weight. You can get them to quit smoking. But if you always go by your own style, which is, I'm going to present the information this way, it doesn't work. You have to adapt. You know, the only reason I took the exam table out of the office was because my patients didn't believe when I asked them to exercise that they felt I actually exercised with them. They didn't believe I exercised. They didn't believe I ate healthy. So my thing was, be the change. What can I do that can inspire people? How can I show people that I live the same thing that I keep trying to tell them? You know, anybody in the department will tell you, I haven't had a donut since I started at Kaiser, ever. I bring the same food to work every single day. And I don't do that because I'm on some crazy mission. I do that because it's very simple. When I look at a patient and I tell them I want you to change because I believe in you, they have to look right back at me, at my eyes, and say they believe in me. And if they don't believe in me, I will never get them to change. The only reason I get people to lose weight the way I do is because I believe in them every single time, and I adapt to whatever it takes. I have taken patients out of the room just to take them for a walk outside. We have done walking clinical appointments. The only reason I did that because I felt at that moment that's what they needed to truly change. It's not the system we may know, but it's the system of the future, which is we are the future. We are the doctors of the future, and the way we're going to be that is to be able to adapt to new and different, unique ideas that we didn't traditionally think about because those just weren't the common thing. That is all I leave you guys with. And the last thing I wanted to say is I'm so grateful to Dr. Suda, Dr. Ellison. You know, Dr. Suda has believed in every single one of my crazy harebrained ideas that I've ever come up with, which I'm so grateful. And I get really nervous because that puts a lot of pressure on me to make sure that I come through with those ideas. But I keep going up and proposing crazy ideas. But I have so many role models. But the most important person I have in my life, of course, that is my wife. And the only thing I wanted to say to her today was that I do, you know, you always say to people is how much you love them. And I don't say that enough because I'm a workaholic. And I've always been a workaholic. But you can't do anything without your heart. And my heart's sitting right there.